The birth of a baby is a wonderful and a very complex process. A baby must make many physical adjustments outside the mother's body. Newborn babies who need intensive medical care often put in a special care called the Neonatal Intensive Care Unit. It has an advanced technology and trained healthcare professionals to give special care even to the tiniest patients. Most babies being admitted to NICU are preterm, less than 37 weeks, has a low birth weight less than 5.5 pounds, or have a health condition that needs special care. In Armed Forces Hospital Southern Region, we have our consultant neonatologists, neonatal fellows, registrars, pediatric residents, and neonatal nurse practitioners. Other teams also include pediatric cardiologists, ophthalmologists, infectious disease, pediatric nephrologists, pediatric neurologists, pediatric surgeons, pharmacists, respiratory therapists, wound care nurses, dietitians, and preventive medicine. Nicu team members work together to create a plan of care for the high-risk newborns. Every year, an estimated 15 million babies are born before 37 completed weeks of gestation. Subcategories based on gestational age are extremely preterm less than 28 weeks, very preterm 28 to 32 weeks, moderate to late preterm 32 to 37 weeks. Most preterm babies are having respiratory distress syndrome. It occurs when there is no enough surfactant in the lung. It is confirmed by radiographic X-rays and clinical findings. To treat infants with RDs, we often give Survanta as soon as possible. It is given through endotracheal tube. Preterm babies may undergo intubation and attached to mechanical ventilator support. Blood gases are done with babies on oxygen support. Babies may be weaned to SPAP, high-flow nasal cannula, blended oxygen, and even in room air if tolerated. Low birth weight babies may not suck effectively, so we use enteral feeding tubes to feed the baby. This type of feeding is used until the baby's coordination between sucking, swallowing, and breathing are well developed. Some of premature babies are unable to take anything by mouth. To make sure babies are getting adequate nutrition, Nicu staff starts to administer fluid containing glucose, sodium, potassium, chloride, calcium, magnesium, and phosphorus. This type of nutrition support is called total parenteral nutrition. Healthcare practitioners insert peripheral lines to a large vein, so the baby can take higher amount of nutrients. Peripherally inserted central catheters may also be inserted to use in giving TPN and medications. Catheters may also be inserted in both umbilical, artery, and vein if the baby is very small or sick. Fluids and medications can be given through the umbilical venous catheter. Blood can also be drawn from umbilical arterial catheter for laboratory tests. Other procedures in Nicu for preterm babies include blood transfusion, exchange transfusion, lumbar puncture, and examination for retinopathy of prematurity. Babies who weigh more than 1.8 kilograms, able to be fed orally, and doesn't need oxygen support, are kept in grower area until discharge. The doctors and the nurses, together with the team members of Armed Forces Hospital Southern Region NICU, ensure to provide a quality patient care, even on busiest and toughest time.
في كل عام يحتفل العالم باليوم العالمي للطفل الخديج الموافق ل17 من نوفمبر، ومن أهداف الاحتفال باليوم العالمي للطفل الخديج ورفع مستوى الوعي عن الولادة المبكرة والطفل الخديج، التوعية بأهمية متابعة الحمل لتجنب الولادة المبكرة، المحافظة على الوزن المثالي أثناء فترة الحمل، وكذلك تثقيف النساء الحوامل للمحافظة على مستوى سكر الدم وضغط الدم في المستويات الطبيعية. وفي كل عام يولد ما يقارب 15 مليون طفل خديج، وهذا يمثل 10% من جميع المواليد في العالم، وهذه الفئة تحتاج إلى عناية خاصة طبية، ولذلك تم إنشاء وحدات العناية المركزة لطب الأطفال حديث الولادة في جميع المنشآت الطبية. مستشفى القوات المسلحة بالجنوب لديه عناية مركزة لطب الأطفال حديث الولادة، وتكون من 70 حاضنة، وهي تقدم الرعاية الصحية المتقدمة، ومركز مرجعي لمستشفيات القوات المسلحة بالمنطقة الجنوبية. نحن في مستشفى القوات المسلحة نستقبل سنويا ما يقارب من 450 إلى 500 طفل خديج.